And welcome back. I'm Mabel Jong, and you're watching Day 2 coverage of the World Healthcare Congress here in Washington, D.C. Thank you so much for tuning in. In the studio, we have now Joyce Chan, who is VP Population Health Strategy at Healthfirst. Joyce, thanks so much for being here.
Sure.
Now, tell me a little bit about Healthfirst.
Yep, Healthfirst is a health plan that is based in New York City. We've been around for over 20 years, and we're primarily a Medicaid plan. We have 1.2 million lives, 950,000 of those are Medicaid. We have 130,000 in the Medicare space, and the rest are in the exchange products, managed long-term care, and some other products.
Mm-hmm. Have you noticed also an increase in enrollment, or how are you actually dealing with that, if you are?
Yeah, no, we've grown tremendously in the last few years, some through acquisition, but a lot organically as well. With the Affordable Care Act and the exchange and everything like that, we're starting to diversify into other products, and it keeps things very interesting for us.
Absolutely. What was the session that you participated in today?
Sure. I was on a panel with Bob Brett from CareSource, and it was moderated by Meg Murray from ACAP about the Medicare star ratings and some strategies for improvement on the star ratings.
And what were some of the takeaways that you left with the audience?
Yeah, so there are a couple of things. One was really around how we partner with providers and how we partner with providers and vendors to really maximize star ratings. And it really is twofold. One, when you think about the vendors that you work with, really holding their feet to the fire and getting service level agreements and performance guarantees, because they really can impact your star rating very dramatically. And probably the pharmacy benefits manager, a PBM, is one of the biggest examples of this, where you really can get these performance guarantees in place and have them have a stake in the game. There are other vendors, of course, that health plans work with a lot, and every single touch point to a member can impact your CAHPS ratings, can impact so many things that ultimately influence your star ratings.
Sure.
On the provider side, it really is around putting in pay for performance programs, so similar kind of thing, with your providers. When you think about the clinical measures and also the member experience measures, the doctor and their staff directly influence that. And so again, making sure that their incentives are aligned with the health plan's incentives is really important. But it's more than just putting the money out there. It's about providing the support underneath that as well. So robust data, timely actionable information that the provider can act upon is really important, as well as just more general support around what the measures really are, what are the exclusions to the measures, how can the provider really perform and do well on them.
I was going to ask, how are you determining what measures you're using and how the kinds of standards that you're having your providers meet?
Sure, so we base it on the star ratings themselves. There are, I think, nearly 50 measures now that are in the star ratings, but not all of them are impacted by a provider. Some of them are more plan-centered, so things like plan customer service, right? The doctor is not really going to have much impact on that. But how quickly can a member get an appointment? That is absolutely impacted by the provider. Or the breast cancer screening rate, also impacted by providers and their recommendations. So we look at the measures that a provider directly influences and also sometimes indirectly influences, and we include that in the program.
And how has that worked for you?
We've had a P4P program for 5 or 6 years now, and we've actually looked at our expansion of the program, as well as we've included more and more reporting and data behind it, and we've seen a really nice trajectory in our quality scores. So it tells a really nice story.
Absolutely.
And we put a lot of focus and energy into that program because we see it as the vehicle for really driving our performance.
And do you find that since we've switched from a wholesale to a retail environment now for health plans, are you seeing that consumers are really paying attention to these ratings?
Yeah, and we see that a lot more in the exchange, and where consumers, they as they're shopping for plans, they see that star rating, and it really makes an impact. Alongside, that star rating is sitting there right next to the price, the premium, and what we've actually seen, we've been 5 stars on the exchange for the last couple of years, and we were priced very competitively last year, and we saw a really nice uptick in our enrollment. And so we really do place a premium on quality because consumers are more educated and they're savvy and they're looking to that quality rating.
Absolutely. Great. Thank you for those comments. May I ask you, how did the World Healthcare Congress make it onto your calendar this year?
Yeah, I've received notices about this in the past years. This is the first one that I've attended, and I've been very, very engaged in it. It's been really wonderful to meet a lot of people who I've seen at some of the other conferences I've attended, but also some new faces, and so making those connections has been really nice. I'm really glad I attended.
All right, Joyce, thank you so much for your time today.
Thank you.
Appreciate it. And I'm Mabel Zhang. Thanks for watching. More interviews to come.